In today's video, I'm going to show you the best back exercise you can do to relieve that back pain from lumbar spinal stenosis. Hi, my name is Dr. Rob Bates. I'm a chiropractor and a certified athletic trainer. And before you perform any of these exercises, make sure you check with your healthcare provider to make sure this is correct for you. First exercise, you want to get on all fours, just like you're doing a cat camel. So you're just going to start arching the back, hunching it forward, and a little bit back, hunching it forward. You want to accentuate the flexion part because with lumbar spinal stenosis, you want to avoid extension. So you want to get more flexion so it opens up the canals and starts relieving that pressure on the nerves. That'll help relieve some of the pain. So you want to flex, contract the abdominal muscles tightly, bring your chin to your chest, and then relax. Contract, bring it chin to your chest, arch the back, and relax. Contract, chin to your chest, and relax. Perform 10 repetitions. Next exercise is going to be abdominal curl-ups. So when you perform these abdominal curl-ups, you're going to go on your back, and a normal curve of the lumbar spine is like this, lordotic. So the belly button would be up here. You want to contract the abdominal muscles so it flattens out that curve. So it'll start relieving, opening up that tight hole from the stenosis. So it'll start relaxing the rectus spinae muscles, decreases the compression. It causes strengthening of abdominal muscles, but then it relieves the nerve pressure, further relieves it to allow it to decrease pain. Brace abdominal muscles, brace, contract, come on up, flatten out the lumbar spine. You want to reach, grip and reach, bring your chin to your chest, hold it there for a 10 count. By doing that, it's strengthening abdominal muscles. It'll help relax the muscles in the back, decompress the spine. Relax. You want to perform 10 repetitions. Next exercise is a spinal twist. So this one you want to lie flat on your back, put your arms, palms up, bring your hips up 90 degrees, your knees about 90 degrees, bring them together, rotate to the side while you keep your back on the ground. So you're contract the abdominal muscles, let it stretch on over. You may not get all the way to the ground or else your arm will come up. Most people with lumbar spinal stenosis. So you go down as far as you can, you take deep breaths, relax, keep the contraction of abdominal muscles. You want to do this for about 30 seconds to a minute. It'll slowly start working its way to the ground. Then reverse, go to the other side, turn your head to the opposite side of the legs. Take a deep breath. It's going to kind of lengthen and stretch out as it's actually strengthening those muscles. It'll help decompress the spine further by decompressing the QL, the obliques, along with the rectus spinae and the multifidi. You want to repeat that. And you want to perform 30 seconds to a minute each side. Do it 2 times. Now you want to perform these exercises 2 to 4 times a day. Do it every day until you get that desired pain relief. Once you start getting that pain relief, then it's important. I'd advise going into the second part of the care where you're actually working on correction of the cause of the lumbar spinal stenosis. You're going to do these 3 things. Number 1 is increase the strength and endurance of the core muscles for spinal stabilization. So you're going to do the abdominal curl-ups, the lateral plank, and the bird dog, and then glute bridges. Number two is you want to restore the segmental dysfunction of those lumbar vertebrae by getting in there and having a chiropractor do a specific chiropractic adjustments to restore the proper motion. Number 3, studies show that people that have lumbar spinal stenosis are going to have a decrease of lumbar lordosis. That puts abdominal pressure on the disc and the joints of the spine. Over time, that's what produces the degeneration, the osteoarthritis, the degenerative disc disease, until eventually you get the lumbar spinal stenosis and that chronic pain. So what we need to do is to change that. You got to restore the lumbar lordosis properly. Get the curve back. The optimal range of lumbar lordosis is over 35 degrees. The range would be about 35 to 40 degrees. Now, performing these corrective exercises will allow you to restore the proper function and structure of the lumbar spine, which will stop the spinal stenosis, cause some reversal, and give you some long-term pain relief benefits.